So good evening to one and all. It gives me immense pleasure to welcome you all to this webinar hosted by the Amrita Alumni Association Kochi campus. I'm Dr. Priya Nair, Associate Professor of Gastroenterology at Amrita Institute of Medical Sciences. I am so honored to say that I am an alumnus of this prestigious university, Amrita Vishwavidyapitham. Again, the Amrita Global Alumni Network is the formal Amrita Alumni Association for the university. Again, is a great way for students of Amrita University to reconnect, refresh, and reminisce. We are still on the road to enrolling all our alumni into this network. As part of these ongoing efforts, the Amrita Alumni Association has arranged this session on career prospects in the United Kingdom for doctors. The hunt for befitting job opportunities is an endeavor that begins the day we start medical school. Unlike many other professions, medicine has the unique issue of licensing that tends to be different for different regions. It often seems a daunting task when trying to choose where we want to relocate. We thought we could help our students by connecting them to people who have been through the process. We are proud to say that in just the past 4 years, 28 students have been able to secure permanent employment positions in the United Kingdom. We hope this session will be an opportunity for you all to pick the brains of some of our esteemed alumni. So without further ado, let's get into the webinar. Before we start, I would like to invoke the blessings of our most beloved Amma, the inspiration and driving force behind this entire institution. I request everyone to join us in prayer. On that auspicious note, I am honored to invite our Honorable Medical Director, Dr. Prem Nair, who has taken time out of his incredibly hectic schedule to be with us online for this initiative to deliver the presidential address.
Om Amriteshwariye Namaha. My very warm wishes to all of the alumni. Let me congratulate our alumni who have taken the time to be here and thank them profusely for participating and providing the needed advice and directions to our students who are in a large measure dependent on our alumni to get the maximum possible information on how to proceed with moving their educational pursuits to the UK. I would also congratulate the Alumni Association for maintaining their contacts and keeping in touch with all of our students around the country and around the world. Given the large number of students today in the UK and the US and Australia and other English-speaking countries, it is really an advantage for our present students to get the experience and know-how and the intricacies of applying to the UK. So I would once again like to thank all of our alumni, and we would want you to continue to be in touch with our institution and be able to guide our students. Alumni are an extremely valuable resource, and today we see Amrita ranking rise very rapidly to close to the first to the fifth in the country. And we would like you to be part of that achievement and contribute towards it. I thank you all once again for being here for our students and would like to see this an ongoing, continuing process. Thank you all. Om Amriteshwari Namaha.
Thank you, sir, for your words of inspiration. Next, I'm delighted to invite our beloved principal, Professor Vishal Marwa, who has enriched this session by his presence to felicitate this event.
Om Amriteshwaraya Namaha. Humble pranams at the lotus feet of dear Amma. It gives me immense pleasure in speaking at this Amrita Alumni event today. I thank the organizers for giving me the opportunity to speak. Especially thank Dr. Nair, who, in spite of being outstation, he's been on a very rigorous schedule last few days. He's been yet able to come. I'm really grateful for that. I am pleased to learn that Dr. Manikandan and Dr. Fajish, our alumni, are speaking today. And they will be interacting not only with our students, but also our alumni, because the junior students who are in the batches of 12 to 15 batch, especially, some even senior than that, they are the ones who are actually looking for directions, because I have personally noted in the last 5 years how much support which actually comes from our alumni getting direction, especially to go to UK and United States, and occasionally in some other countries also. And the topic career prospects in UK is a very important topic, and I'm sure it will be attended by many, and those who don't will probably miss out. The recorded version can be shared with them subsequently, which I'm sure Dr. PG Nair and Dr. Priya Nair and Dr. Ramakrishna will definitely facilitate that. I will also thank the alumni for their wholehearted support in our undergraduate conference. First, we received many messages from them, and they were very useful and very motivating for the students. In fact, I was told by the undergraduates that it was very motivating to get the messages. I think Dr. Manikandan had also sent one message, because I have seen that video. Thank you for that. And in fact, yesterday was a plenary, and there were 2 sessions, one on rheumatology, it was on SLE, and then oncology, where our Dr. Pradeep Jacob also spoke yesterday. It was wonderful and was attended by around 1200 was the attendance yesterday. So that shows how much is the impact. And we have a leadership challenge, in which Dr. Arvind Sukumar, our IPS, he's our alumnus of, I think, 2005 batch. He will be also joining in. That will be around 28th. So I thank all the alumni for their, support to us. It has been always there, and we are very grateful for that. I wish all deliberations today great success, and thank the organizers for executing and working hard to execute this function. Jai Hind. Thank you very much.
Thank you, sir.
Thank you so much, sir, for your wonderful words of support. So with this, we move on to the main event of the evening. I'm so proud to introduce you all today to Dr. Manikandan Kadirvel, my co-batch during our super specialty training in Amrita. He is a 2015 batch alumnus of MCH gastrointestinal surgery and received the gold medal in GI surgery in 2018. After that, he joined Cambridge University Hospital as a senior clinical fellow in multi-organ transplant and retrieval surgery in November 2018. There, he completed his NHSBT certification in multi-organ retrieval surgery. He then joined Royal Free Hospital, London in January 2020 and is working as a senior fellow in HPB liver transplant, and multi-organ retrieval surgery till now. He has also decided to give back to other students by sharing his experience. He is a course director for the study of FRCS and MRCS, an international teaching platform for training surgeons for Royal College exams. Before handing over the platform to Dr. Mani, I would like to call upon the two chairpersons for these sessions, two of our beloved teachers, familiar to most of you all. Professor O.V. Sudhir, HOD and stalwart of GI surgery at Amrita, an ultimate authority on laparoscopic GI surgery in the state and nation, the teacher who works magic with a robot. In fact, Sir is one of the only certified trainers in using the Da Vinci robot in South India. Sir, we are so honored to have you with us today. We also have Professor Pradeep Jacob, Head of Department of General Surgery. When we all think of MBBS at Amrita, one of the teachers who pops into our mind is PJ Sir, as we affectionately call him. From the beginning of MBBS in Amrita, he has always been a brilliant teacher, affectionate friend, and a patient guide to all our alumni. So many laughs and so many good memories. Sir, thank you so much for being here with us. Over to you, Sudhir Sir and Pradeep Sir.
Thank you, Priya. Thank you for the nice words. Some students make their teachers proud. Mani is one of them. He was our GA surgery alumni during the period 2015 to 2018. He was a bright student. And apart from that, he was always keen to teach his juniors, junior colleagues, the undergraduates, and the MSc postgraduate students. Now, I know that he is the heading the unit of International Teaching Medic, a group of doctors who do training to pursue their studies abroad. And Mani is heading the unit in UK. I'm very happy to know that. And also, I am glad to see that many of my colleagues, my students like Dr. Guhan, Dr. Manoj, and Dr. Akshay are also working with him in training the students to pursue their international courses. Now, for the students, the sky is the limit. They would like to go abroad. Many of them would like to go to UK to pursue their higher studies. Mani is going to tell us the career prospects in UK, the training in UK, the requirements for training in UK, its advantages and its disadvantages. Welcome, Mani. Please.
Thank you, sir.
Yeah, Dr. Mani, I think
sir.
we can start. I don't want to stand between you and your, I think the rest of the alumni and our students are eagerly waiting to hear the talk.
Okay. Sure.
Priya, thank you for your kind words of introduction. I'm extremely glad to see a lot of my old students among the audience today. I've not had the pleasure of interacting with Dr. Manikandan that much, but like Priya mentioned, I usually work at the grassroots level. I interact more with the MBBS students and try and push them up the ladder. So it's very nice to see a lot of friends from the O2 batch, Fajish. So nice catching up with you. And I wish all of you a healthy deliberation and maybe a opportunity to study in the UK very soon. You can start off.
Okay. A very good evening, one and all. Thank you very much, Prem Nair sir, Vishal Marava sir, OVS sir, and Dr. Priya for your kind introduction. And a special thanks to PG Nair madam for choosing me today to give a talk on this topic on behalf of Amrita Alumni Association. So without wasting much time, I will go into the topic. I will be speaking for 30 to 35 minutes. So the topic for today is career prospects in the UK for doctors, predominantly from India. So because the audience for this presentation is very diverse, starting from undergraduate students, postgraduate, super specialty students, and even practicing doctors, I have designed my presentation in a way that it gives you a very broad picture of how your training would be and how your lifestyle would be in the UK, if at all, if you choose UK as a destination for your higher training in your career of medicine. So I am Dr. Manikandan Kadirvel. I am one of the very proud alumni of Amrita. I did my MCHGI surgery between 2015 and 2018. At the moment, I'm working as a senior fellow at Royal Free Hospital, and this is my hospital, the Royal Free Hospital London at Hampstead's Heath. Okay, so going to the topic. So why is this topic important for every one of us? As the medical director, the principal, and Sudhir sir told, for the undergraduate students, the things are becoming more and more difficult in terms of competitiveness in the field of medicine. Maybe it is the entrance exams or the reservation patterns or whatever it is. I think every one of the undergraduate students should be aware of whatever the possibilities are available overseas for them to go and train themselves. For the postgraduates and the super specialty doctors, I think we are slowly moving to the era where patients are searching for doctors who are specialized within a particular field, within a specialty. No more patients prefer GI surgeons or plastic surgeons, but they prefer GI surgeons specialized in transplant, specialized in robotic surgery, or say intestinal failure surgery and things like that. So we are slowly moving to an era, even India is moving to an era where even the super specialty training is not enough, and we need to go and micro specialize within our field of specialty. And unfortunately, the Indian system at the moment doesn't give much of an opportunity for most of us to specialize like that. And I personally feel that UK is one place where you can come in and train yourself in a very particular field within your subspecialty. And as a disclaimer, it is not an advertisement. I am not boasting that the UK training is very good or anything. I did all my surgical training from India, and wherever I stand today among the European surgeons or the British surgeons, it's all because of the Indian training, and I'm feeling proud of it. And it's just an overall guidance for people who are thinking that UK is an option. And moreover, unlike the pathway to United States, where it is very clear, just giving an USMLE exam, you finish, go in, and then search for your roots. UK has multiple pathways of entry. One. Second thing is, because of Brexit and because of the recent change in the policy by the government, that all the healthcare related jobs are put under shortage of occupation list in the UK. Now the competition is open to everyone. So previously the preference was given to European Union people and the British people, but now it is open to all. So the chances of getting a placement for training or for a fellowship is much made easier at the moment. Okay, so in my presentation today, I will be covering in general why doctors wants to move to UK. Second thing, in my perspective, what is the difference or the advantage of UK training compared to Indian training? And thirdly, the most important things, what are all the basic requirements a doctor as an international medic should have to enter the UK? And what are all the career options which the doctors can choose in the UK? Very brief about how's my lifestyle in the UK, the drawbacks, and finally some take-home messages. Okay, so why UK training is chosen by doctors, international doctors who have come into UK. So when we speak to the doctors who come into the UK, they come with various reasons, and these are all the following reasons. Many of them come with an academic goal of having a more focused training in a particular area, as I told before. Many come in to see how the Western protocol-based treatment works. And many of them come here for strengthening their CV and to do quality research. Few come here with the financial intent of having a good lifestyle, getting more salary, and they feel that when they come into the UK and train themselves, their global job opportunities increase, and hence their lifestyle and the income increases. Few come just because of peer pressure, just because your friend came here, they just want to come here and experience. And many doctors in the last 2 years, we can see even the senior surgeons, senior doc physicians, they come here quoting that they're not happy with the Indian system. I might be wrong here, or job insecurity. And among the undergraduate students who come into the UK, they tell that they have difficult entrance exams, difficult procedures and protocols for getting a place in the post-graduation or the super specialty training. And many come here just like that, just they might accidentally get a slot or a place in the UK to train, so they come in. So this is overall about the reasons with which international doctors come into the UK. So in my perspective, what difference I felt in the last 3 years compared to my training in India is, as I was repeatedly telling before, this is one place where we could get a very focused training or a particular area. So the hospitals in the UK are grouped together in a way that each hospital or a particular hospital handles a particular complex, benign or a malignant problem. For example, we have like 7 or 8 centers which handle liver transplants. We have 2 or 3 centers handling intestinal failures. We have specialty centers for bariatric procedures, specialty centers for motility disorders, and things like that. For even say, if you take orthopedics, they have specialty centers for arthroscopy. If you take obstetrics and gynecology, we have high-end specialty centers for fetal medicine and things like that. So in my view, if any of the doctors, maybe the super specialty doctors or the postgraduate doctors, if they want to specifically focus on a particular area and train themselves, I think UK would be one of the best options to come in, work for 6 months to 1 year. And the work here is, because it is an NHS system, which is a free health system, you get ample hands-on training here. So you get very well trained and you go back as a specialist in that particular specialty within your broad specialty. And the most important thing is the MDT approach, which we follow here. So majority of the UK hospitals, they handle the MDT pathway to decide the best possible treatment for the patient. Except for the emergency procedures, either it is a benign elective or a cancer elective, everything passes through an MDT, and which helps the trainees here a good platform for them to interact with the doctors of other specialty, or to see the patient from the other specialty point of view. And similarly, we can feel much, much happier by giving the best treatment option to the patient. The most important thing and the most difficult thing, which I found difficult when I came into the UK, is the communication skills here. So here, we need to talk more, whether it is getting a consent or breaking a bad news or whatever, or the clinic communication. So we spend 50% of our clinical time in the hospital talking to the patient. We need to make sure that the patient understands whatever we say, and we make decisions for the patient along with the patient, rather than a physician-centered or a surgeon-centered approach, which I see in many of the centers in India. Fourthly, it opens up a global opportunity. UK is a multicultural society where doctors from various parts of the world come here and work. So it gives you the opportunity to interact with doctors from various countries, to know the system in various countries. You can go there, you as an observer, train yourself in a particular hospital, and you can come back. And definitely coming into the UK and spending some time in one of the reputed centers here will strengthen your CV and gives you a very good opportunity to get a placement back home in India or in overseas countries like Singapore, Australia, Gulf, etc. And you will get a lot of opportunities to do very quality research, and you can do good publications, and you can do very high quality audits. And we can have, you will be having the advantage of developing, having friends from various countries, various ethnicity, etc. And NHS overall is a very different health system. It is a free health system for everyone in the UK, where everyone are considered equal, and the treatment is given only based on the priority, rather than whether you have money or whether you know someone or not. So everyone are treated equally. If a priority treatment is needed, whether it is a benign problem or a cancer problem, it will be given. But if it is an elective and if it is a non-priority way of treating the patient has to stand in the queue to get their treatment, which is, again, I think as a doctor, we should know how such system works. And overall, it is a very different lifestyle compared to the practice in India. So you would get a very good work-life balance here, and of course, a good income. So this is, in my perspective, how a trainee or a doctor who is working in the UK finds it different from how we practice in India. Okay, so once you've decided that, okay, let UK be an option for you in your as a place for your higher training in the field of medicine, these are the certain questions which you need to answer yourself before you decide which pathway or which career you need to choose in the UK. So the first question you need to answer is how long you are happy to spend in the UK, whether it is a short term or a long term, and what is your long term plans? Is it an open plan, like if things are fine, you might settle in UK, or you have a very fixed plan, like you need to come back to India? So depending on what is your long term plan and how long you can come out of the country, you need to be you need to choose your career. Second thing is, what is your purpose? So what is your purpose of coming here? Is it for your lifestyle, or is it for your income, or you want to specialize in a particular area? So depending on that, you choose which career, which place, which hospital, and things like that. Most important thing is your family. So, and that is the biggest drawback, which I would be explaining later as well. So the support system as a family here is very, very difficult. So you have to look after your family as a whole. You won't have maids to come in to help you. You can have, but it's very, very costly. And so if at all, if you are having a family with children, it will be either you or your spouse needs to sacrifice their career to some extent to look after your kids. And you need to do all your household works, unlike the help which we can get from India. So your family situation matters. Similarly, if you have someone who can come and stay with you, again, that's a biggest advantage which you can have. And the fourth thing is what kind of contacts you have in terms of your friends, your relatives, or even doctors who work in different hospitals here, because that helps you a lot in deciding the place or the hospital or what is the kind of job you can take. And finally, what is your strength with your training in India? For example, if you are a super specialty trainee and if you think that you still need some kind of a training in as a broad specialty, as a general surgery or a GI surgery, you should try to take a job which gives training as a whole perspective. So in that case, you will try to take a job in a district general hospital where you will be exposed to a lot of general surgery work. But on the other hand, if you think that you are well settled and well trained in your broad specialty, and if you want to subspecialize in only a particular field, then you can select your post or a job in that particular hospital. So these are all the questions which you should answer to yourself before you decide which pathway and what post or what kind of job you would take in the UK. Right. So going to the most important talk. So what is the basic eligibility to enter into the UK? So irrespective of whether you are an undergraduate or a postgraduate or a practicing physician or a surgeon in India, what you need is you need a General Medical Council registration to come into the UK and practice, or you train or whatever. But if you want to just do a clinical attachment or an observership, GMC registration is not needed. Okay, so what is needed to get a GMC registration? There are 4 pathways in which you can get the GMC registration. In the sense, the 4 exam pathways or the 4 pathways with which you can get the GMC registration. One is the PLAB route. Again, PLAB is an entry exam. predominantly taken by the students who have just finished their basic medical qualification in other parts of the world. Say, for example, if it's candidates who have finished MBBS alone and who wants to come into the UK, they take the PLAB route. So PLAB is an exam which happens as two parts, PLAB, part 1 and part 2. Part 1 is an MCQ-based exam and part B is an OSCE-based exam. And from candidates, whoever had written the PLAB exam, I was told that it is a bit easy exam when compared to USMLE or the NEET exams, which happens in India. So this is for the undergraduate students who has finished. If at all, if you have finished your post-graduation, say in medicine or surgery or whatever, the best way for you to get GMC is to finish one of the Royal College exams. So if it is for surgeons, the MRCS exams. If it is for physicians, the MRCP. If it's for obstetricians, the MRC-OG. If it is psychiatry, MRC of psychiatry, and things like that. So you have to clear one of the Royal College exams. Or if you feel that your Royal College exams are difficult in your specialty, then you can take a PLAB exam. So these are the two exam pathways through which you get the GMC registration. The third thing is called MTI. Say if you don't want to give PLAB and you don't have a Royal College exam cleared, then you can take this option called as a medical training initiative. Okay, so the medical training initiative is provided by the Royal College of all the specialties, Royal College of Physicians, Obstetricians, Psychiatrists, Anesthetists, Radiologists. They all provide this a service for the international doctors to come into the UK and work for 2 years and then go back. So if you want to get a GMC registration through MTI, you will be provided 2 years of temporary GMC registration. You come here, work for 2 years and go back. And the prerequisite for getting a placement through MTI is you should be working in a overseas hospital. You cannot be applying for MTI after moving into the UK or having a visa, either it's a dependent visa or a work permit visa within the UK. So, through MTI, you will get only the temporary 2-year registration. But if you clear PLAB exams or the Royal College exams, you will get a permanent GMC registration. And the fourth way, which is very, very rare pathway, is a sponsorship. So sponsorship is like if you know a consultant in the UK who very well knows you and who can give in a writing to the Royal College stating that this particular candidate has the knowledge in par with the UK training, then you can submit that sponsorship letter to the Royal College, and the Royal College will sponsor a permanent registration for you through the GMC. But this way is very, very rare. So these are all the 4 pathways which you should choose. So again, I can come for one by one. So PLAB exam is the best way for the undergraduate students to take in. The Royal College exams are the best pathway for the students who had finished their postgraduate exams or the post-graduation training in India. Again, the postgraduates still have the option of taking the PLAB exams. And the third option is an MTI where you are allowed to work only for 2 years with a temporary registration number. And the fourth pathway is sponsorship. So once you clear either of these exams, you need additional documents for the GMC applications. These are, one is you need to clear your English proficiency exams. That is the IELTS exams or the occupational English test exam. Both these exams are accepted now. And if you take IELTS exams, you should take the UKVI academic type of the exam, or if you take the OET exam. So again, GMC has a very high scores which is set for the IELTS. You need to get on an average of 7.5 in IELTS exam and a grade B in OET exam. So you need to clear this exam, and you need to verify your basic medical qualification by the ECFMG. I think many of the undergraduate doctors might know this. So this is an authority in the US which verifies your primary medical qualification. So the ECFMG has to verify your primary medical qualification, and they will refer to the GMC. And you will need 3 structured references from your bosses from wherever you work. And you need a basic medical degree certificate. And this is very, very important, where most of our students get into trouble. So the GMC looks things very seriously when you are out of employment for more than 3 months. So when you fill the application form, there is an area where you will be filling your experience. And if you have a gap in your employment for whatever reason for more than 3 months, you have to give a proper explanation. If the explanation is fine, they would accept. If they think that you were out of employment for no reason, then there are some difficulties for you in getting the GMC registration. So you should be careful about this. And apart from the IELTS exams, ECFMG and things, you need to clear either the PLAB or the Royal College exams or the MTI sponsorship. One thing about the PLAB exam, unlike the USMLE exam, where you can write the exams during your MBBS itself, PLAB exams you cannot write. So the earliest possible time when you can apply for Part A PLAB exam is during your internship. You cannot write the PLAB A when you are doing your MBBS course. And PLAB A, the first part of PLAB happens even in India. But for the second part, you need to come into the UK and you need to give your exams here in the UK. So this is the process for GMC application. Okay, right. So once you get the GMC registration sorted, next you need to decide which career and what to choose in the UK. Again, as I told you before, you should have answered all these questions like how long you can be out of your country, what do you need, and what is the purpose. So this is the table which shows how the UK course of training or the deanery training works here. So once the candidates here finish their basic medical school, they enter something called as the Foundation Year Training 1. The Foundation Year Training 1 is equal to the internship or the CRRI in India. So here they have 2 years of internship. So all the doctors who finish their medical school, they have to do 2 years of internship. After that, they will apply for the deanery to get into the post-graduation. So if you take a surgery as your post-graduation, they will do something called as core training 1, which is called CT1, and core training 2, which is called CT2. If you take medicine as your specialty, same thing, you will have CT1 and CT2. And then after the 2 years of core training 1 and 2, here the surgeons have to give their MRCS exams and the physicians have to give their MRCP exams to enter further training. So between the year 2 and year 3, the candidates will be given the choice of selecting what specialty they need. Unlike in India, where we do a general surgery and then we write the exams and then we go here. Similarly here, we write the MRCS exam or the MRCP exam here. You choose your specialty and then enter the specialty training ST3, ST4, ST5, and you go through 6 years of training. And at the end of ST8, you have to give your exit exam, which is for the surgeons, it's the FRCS exam. And after ST8, you will get something called as Certificate of Completion of Training, which is called CCT. And then you enter the specialist register and then you become the consultant. So this is the route in which a trainee who is coming into the UK will go through. If an undergraduate student from India wants to come into the UK and start their training here, so you will finish your MBBS in India, you have to clear your PLAB exams, get your GMC registration, and you will start your career in the UK as a foundation year 2 or a foundation year 1. And from there, you choose whatever you can enter surgical training or a physician training, or you can take obstetrics, orthopedics, or whatever. Unlike the surgical training and the physician training, the other specialties like obstetrics, pediatrics, orthopedics, they have something called as a straight go-through pathway where you will start as an ST1 and you finish as an ST8. So there is no gap in between. But if you want to do surgical specialty, then you have to do a core training here and then an MRCS here and then go there. So that's why people tend to prefer in specialties like obstetrics, orthopedics, or pediatrics here, because after your foundation year training, once you enter here, you will come out at the end of 8 years as a consultant. So this is how the pathway for the undergraduate students. If For example, a postgraduate student wants to come into the UK, or a super specialty student wants to come into the UK, or a practicing doctor wants to come into the UK, then if you had finished your Royal College exams already in India and you got your GMC registration, you can start your training straight from ST3 here. You start your training from ST3 in whichever specialty you want, and you finish your training at ST8. So, so this is how it is, depending upon at what level of career you come into the UK. So as an undergraduate student, you finish your PLAB, then get your GMC, start your training as a foundation year one or year two. As a postgraduate doctor or a practicing surgeon, you can finish either PLAB, or you can finish either the Royal College exams and then get your GMC, and you can start straight as an ST3 here. So this is the pathway which I would suggest for the doctors who are keen to spend more time in the UK. Say if you're happy to spend like 5 to 6 years in the UK, or if you're happy to settle down in the UK, or if your aims are open, like which if you feel like UK is fine, you want to settle down in the UK, then this is the best pathway, I would say, because of various reasons. One, it is a extremely structured and a very well monitored training system where you will be for each year you have certain set of competencies which you need to achieve, and it will be monitored rigorously by the deanery, and at the end of 8 years you would have completed all the competencies required to become a member in the specialist register, and you becoming a consultant becomes much easier. But if at all, if you think that you don't want to spend more time in the UK and your goal is to just come into the UK, train yourself in a particular field and go back, then you can choose the options like the fellowships. Although the term it is branded as fellowships, it is not fellowships. Basically, it is a job. So it is a non-trainee job. So when you search for such jobs in the website, you will see these terms which are used very interchangeably, and the job pattern between these jobs overlap enormously actually. So you can choose either a junior clinical fellow post or a senior clinical fellow post, or a specialty doctor, specialty registrar, or fellowships post. So these are all the titles of the jobs which you need to look for, either in the NHS website or Track Jobs website. If at all, if your plan is just to come in for 1 or 2 years and train yourself in a particular area, be it is a general surgery, or you want to specialize in a particular area like a bariatric surgery or a transplant or intestinal failure or whatever. So again, a junior clinical fellow or a junior research fellow is a post which I would advise for candidates who have just finished their post-graduation in India. And senior clinical fellowship is a post which I would advise for candidates who had finished their post-graduation and worked for 3-4 years, or who has finished their super specialty training. Again, specialty doctor or specialty registrar and the senior clinical fellow are almost the same, but specialty doctor and specialty registrars are the words are used for broad specialties like general surgery and general medicine, and senior clinical fellowships or senior research fellowships are the words which are used for very particular specialty within the broad specialty like transplant, bariatrics, etc. And very rarely we have certain units in the UK which gives named fellowships, like we have certified IHPBA fellowships, we have some kind of fixed term fellowships where you come in, work for that particular year, you receive a certificate and go back. But all these posts, whether it's when you take a senior clinical fellow post or whatever, all these comes with a fixed term work contract. You come in, work for those years. If you want to continue even further, they will extend your contract, and at the end of 2 years or 3 years of work, you will be given an experience certificate that you worked in this department in this particular area. So these are all the various roles which the doctors from India can take. So So these are all the two websites which are commonly used by the doctors overall to look for various jobs. So you need to go into this website and you need to register yourself in this website. You can express your interest in which specialty you need, and the website itself notifies you the job vacancies, and you can apply straight away through these websites. So these are the two websites, if at all, if you're looking for a fixed term or a short-term training in the UK. And other major important thing which I want to stress for everyone is many people tell that they're not even shortlisted for an interview when they apply for jobs in the UK. It's all because of the way they fill up the application forms. So because we are not trained much in filling the application forms professionally in India, our candidates find it very, very difficult. But the application forms are given very high importance here. Again, each application form is evaluated on a point-based system with points given to each and every area before they shortlist you for the interview. So application process is a chance for the candidate where they need to sell themselves, not only in the field of their academics, but overall as a personality, explaining their leadership qualities, their research experience, their interpersonal communication areas and things like that. So application plays a very, very major role when you want to apply for any jobs in the UK. What if a super specialty candidate or an experienced surgeon who wants to come into the UK and settle down, but they don't want to get into the training number? So again, becoming a consultant through that pathway is very, very difficult, but still it is possible. We have something called as a Caesar route, where experienced surgeons from other countries like India, like I am trying to do this pathway, where we try to submit the evidences that we had achieved all the competencies of an STA trainee in the UK by submitting various documents to the GMC, and we can secure our spot in the specialist register. Without securing a spot in the specialist register, we cannot become a consultant in the UK. So this is the pathway, if at all, if any experienced surgeons who doesn't want to go back into a training pathway and they want to become a consultant in the UK. So again, a very short thing about the MTI. So if you want to search about the medical training initiative, so whichever specialty you are, you just need to type your Royal College name and search as MTI. This will open up. Again, you no need to have a PLAB exam here. You need not clear your Royal College exam here, but of course, you need an IELTS exam or the OET exam for this pathway. You apply to the Royal College, and you will get a two-year temporary GMC registration, come into the UK, and then you practice and go back to your country. But majority of the candidates, what they do is they utilize this option, come into the UK, and during these 2 years, they give their Royal College exams, because clearing the Royal College exams when you're working in the UK is much, much easier than giving the same exams from India. So they come in, they finish their Royal College exams, and at the end of 2 years, they get the permanent registration, and then they continue to work in the UK, or some even enter the training pathway. So this is overall about what is the pathways through which a doctor from India can come in. Finally, very short about how will be your lifestyle in the UK. So again, this is my perspective. You will be given a good pay, I would say. Like for a junior fellow, you will be getting somewhere on an average about £3,000 a month. As a senior clinical fellow, you will be getting as a £4,000 per month. If at all an undergraduate student who comes in and starts their career as a foundation year trainee here, again, he or she will be paid at around 2.5 to 2.8K pounds here, which is which is very much enough to lead a very good quality life here. And if at all, if you want to get some more pay, there are a lot of vacancy duties available in various hospitals, and depending upon your specialty, you can take one of these shifts and you will be paid very well. And most important thing is you have a fixed time work here, and then you will be taken over by the next team, and you have weekends off except for like 1 in 4 or 1 in 5 weekends you work. So you will have a very good work-life balance. And most importantly, if you have kids, the country offers a free education for children, and it's the quality of education is very, very good, because my daughters are doing the school here and they are very happy here, and free healthcare for everyone who works here. And dependents, if they are not medicos who are coming as a dependent on you, they can work here, but they cannot work as a doctor or a dentist, but they are allowed to do any other job in the UK, and commute to India is available easily. And the biggest drawbacks which I faced when I came in is the initial investments which we need to make, because whether it's a PLAB exam or the training for the PLAB exam or the Royal College exam or the IELTS exam, ECFMG, everything is a bit costlier. So on an average, you need to spend at least 2.5 to 4 lakh rupees before you land in the UK. And everything has a very long processing time. If you think that you want to come into the UK now, it will take at least 12 to 15 months for you to process things and come into the UK. And the interviews are a bit difficult, I would say, but again, the difficult is not the way I need to put it. It is basically you need to follow a certain technique of facing these interviews, because we are not used to this interview pattern in India. Our candidates feel it a bit difficult, but if we know the technique, again, interviews are a bit easier, because any candidate, whether they enter into the training program or a senior clinical or a junior clinical fellowship, they have to face the interview before they get the placement here. And lastly, as I told, you may not be having your family support, which is the biggest strength which you have when you are in India, and you need to look after all your household activities, your children, etc. So this is one of the biggest drawback everyone who comes here face. So so the final take-home message to all the undergraduate and the postgraduate doctors is, I would say that you should keep your options open, given that in another 5 to 10 years, I'm pretty sure that the field of medicine would become extremely competitive in India. Whatever our teachers are enjoying, we may not be having the same level of the merit or whatever. So keep your options open, whether it is UK or US. Search for good opportunities, whichever suits you. And whenever you have time, when you have your MBBS degrees in your hand, try to verify it through ECFMG, because most of the overseas training requires this formality to be done. And any specialty postgraduates, whether it's an obstetrician or a pediatrician or a physician, try to clear your Royal College exams. Whether you come into the UK or not, it adds so much to your CV, and it gives the chance for you to tell that you are globally recognized as a general physician or a general surgeon. And then the most important thing is, try to speak to appropriate people to get help and guidance. The biggest mistake most of our candidates do is they will go through the internet, because the internet gives so much of information, especially for a system like UK where there are multiple pathways. You get confused and you get lost, and you'll be wasting years. So get help at the earliest, get guidance appropriately, and don't waste years unnecessarily. And when you are in India, try to build your CV in the form of publications and audits. Again, we as an Indian trainee, we are all extremely strong in academics and hands-on for surgeons, but we lack miserably in publications and audits, which is given so much of importance and weightage when you come into the West. So whenever possible, try to do research. Not just doing the research, you need to publish. Without publication, it's of waste. So you need to publish, try to do very good quality audits and present those audits, and try to attend courses on research methodology, teaching skills, leadership skills, basic life support, ATLS, etc. Because all these things add so much to your application when you apply for any post here. So this is overall about your means overall guidance about how you can choose your path to come into the UK. And as I promised to PG Nair madam, I am very, very happy to help any one of you if you need any further details on any particular pathway. Maybe it is an exam or how to apply or the website issues or strengthening your CV or interview skills or whatever. I'm very, very happy to help and mentor you throughout the course. Thank you very much.
Thank you, Mani. That was a very clear and very extensive way of description of all the pathways to UK and pursue your studies and your career there. Mani, could you please? There is an interactive session now between the and you, and you'll be more of answering the surgical options. And Fajish Habib. Fajish Habib is one of our alumni. I'm very proud of that batch of students. 3 of their batchmates had been my students. They completed their MCH in GI surgery, and they are in a very good position now. So before going to that, Mani, can you please let us know something about your that international medic that train others to get into this.
So what I did is, after coming into the UK, means my initial plan was to stay in the UK for just 1 year, but my plan changed eventually, and I wanted to become a consultant here through the CSER route, whichever I mentioned. And the prerequisite for the getting a CCT here is I need to clear my FRCS exams, the exam which the UK trainees give. So I applied through various courses here and I cleared my FRCS exams in transplant. But what I saw was all the courses were extremely costly. And as an international student who come into the UK, clearing FRCS exams following the UK guidelines was very, very difficult. So what I thought was, I have joined with an international teaching institution called Study Medic. And me, along with my own juniors and seniors from Amrita, we have joined together and we are trying to help students, whoever wants to clear MRCS exams or the FRCS exams, by conducting courses, teaching them, conducting mock exams. And we run a Telegram group. We have more than 600 plus students in the group where we are posting questions every day, posting guidelines there. And soon we are going to start a very structured training program for MRCS. And very soon we are going to start a structured training program for FRCS candidates as well. And in a very, very nominal fee, which any Indian people could afford. I can tell you for a 2-day or a 3-day course, which I attended here for FRCS, they charge like more than £1,000. So that is the kind of money which we spend here when we attend these courses. So we thought we would give it as easy and as simple and as cheap as possible.
Dr. Mani, which was wonderful for sharing, and we'll continue having this interactive session. But on the medical side, pediatric side, we also have another one of our alumni members, Dr. Fajish Habib. He is an alumnus, as Sudhir sir said, of the very first batch of Amrita. And he had a very different course, leaving right after his MBBS to pursue his education abroad. He completed a 4-year residency in pediatrics in Qatar, where he completed his Mrcp CH and then joined a 3-year fellowship in PICU in Doha, Qatar. 18 months into it, he had an opportunity to move to Vancouver, Canada. I'm sure he'll talk to you more about all this. And there he completed a 2-year fellowship in pediatric critical care, where he succeeded in getting a Canadian Royal College Board certification. From there, he moved to Birmingham, UK, where he joined as a senior clinical fellow in Birmingham Children's Hospital PICU, one of the largest in Europe and main referral center for hypoplastic left hearts in the UK. He then got accepted as a locum consultant in the PICU and transport and retrieval team. He works 50-50 with the PICU and the kids team, which is the specialized pediatric critical care transport service for the county of West Midlands. Thank you for being with us, Fajish Chetta, and I'm sure that a lot of people will have questions on how to kind of start right after MBBS or earlier on in their medical career. And I'm sure between Dr. Mani and you and even many of the other senior alumni on the group today, you'll be able to help out a lot of people who have questions. So we're open for discussion.
Thanks a lot, Priya. I just wanted to just add, I think Mani's talk was fantastic and very crisp and very clear. And what I just want to put out there is, so people migrate for different reasons, all right, or move. And that's what you need to be absolutely clear. And I can tell you my own journey's example. So I've done bits and pieces in different places. So it's great on paper from an experience point of view to move to different centers. And it actually adds a lot to your CV. However, where you want to stay and work, if you have all the letters coming from one system, it makes a big difference, all right, in terms of the value. For example, when in Dr. Manikandan's talk, when you saw the deanery training, so that is like the epitome of training here. That is what is considered, at the highest level. So for people who are completing the MBBS, completing the PLAB, and then coming here, starting from their FY foundation year and going through the training is what I would always recommend. Then there are a lot of people like me who have a midlife crisis at some point and then decide to move here and there. And you think that, where I am at the moment is not the best, the grass is greener on the other side, and you then decide to move. And that's where, we start looking at different options for myriad reasons. And that's where you need to be crystal clear why you're moving. And that's the question you have to answer before you go. So whether you want to train and go back, whether you want to train and stay, as in, i.e. immigrate to the UK, or you want to train and migrate elsewhere. For example, a lot of people come here to train and move to the Middle East because, for whatever reasons, financial opportunities are much better there. Or you just want to come here and work in the middle grade rota, so and migrate here for your family's sake. So you need to be very clear on what that is. Now, if you want to get a consultant job, you have to be on a specialty register to get a permanent job in the UK. And that's the pathway that Mani talked about. So either deanery training or the CSER pathway. You have to do either one of these to get a consultant job. Anybody with Indian training who gets a GMC registration, you can get a middle grade job. You can be in a middle grade job throughout your life, and you can still make good money because there's plenty of locum jobs, free posts where you can work in different hospitals and earn money. But you need to be clear, is that what you want to do for the rest of your life? Or is it you want to get a consultant job? So that's something I just wanted to clarify very at the outset. And the other thing that I want to say is also, because I do interview a lot of candidates who come into our fellowship training. And one of the things that I've noticed, like which Manikandan said, and it's extremely important, is the soft skills, communication skills, interview skills. This is where a lot of our trainees lacked. Okay, so how to write your CV and apply itself, and that's extremely important. You have to run it through somebody in the UK to look at your CV. Get somebody, and there is lots of Indian doctors networks here. And I'm sure wherever you work, especially for Amrita Alumni, there's a lot of us here and, in different specialties who can help you out. And the other thing is when you get shortlisted for an interview, how you present yourself and how you talk. Over here, a lot, like he said, matters the way you speak. Okay, you have to sell yourself. Never be humble when you're trying to sell yourself. If there are any questions, I'll be happy to answer from that point of view.
How important is your logbook?
Yes, so that is again a very important thing. At least I don't know about the physician side, but from the surgeon's point of view, almost 99% of the Indian surgeons, we lack maintaining a proper logbook, and we all struggle when we come to a country like this. So in the UK, as they go through the various level of training, at the end of every year, they are supposed to produce their logbook to their supervisor, and they have to sign. So only when they reach a particular competency, they go to the next level. So when we come here and when they ask about the logbook, and again, the logbook here is extremely structured, including the date of birth of the patient, the MRN, and including what was the post-op problems and complications. So that detailed kind of a logbook is what is needed. But the need for logbook comes only when you need it for either to apply for your FRCS exam from the surgical point of view. For the MRCS exams, you don't need a logbook. And for getting a job in the UK, you don't need a logbook. But if you want to apply for the FRCS exams, or if you want to get the CCT through the CSER pathway, then you need to have a proper logbook. Because for the FRCS exams as an international candidate, for the first step is you need to give the application form, you need to submit your logbook and the references, and the committee will decide whether you are eligible or not. If your logbook is weak, you may not be even eligible to apply for your FRCS exams. So I would suggest, like, whoever is in this, so kindly maintain a logbook in some form. There are so many e-logbook versions are available, or whatever. Try to register and keep your documents with you, which will be 100% useful in your future.
Yeah, I completely agree. And for us, actually, in our PICU, when we ask candidates when they are applying, we do ask for a logbook, for example, of how many intubations, central lines, all that we ask them to apply during the application itself. So it can be job specific. So when you're applying for a job, please go through, when you go to NHS jobs, there is the job description, and you have to go through the requirements in that in detail, and it will be mentioned there if you need a logbook or not. But my, like Mani said, its advice is, if you're in training, please maintain a logbook and have it ready, because you never know when you'll need it. Because it's extremely difficult to go back and get that evidence retrospectively. So while you're at it, and these days everything is on a phone. You can easily maintain an e-logbook, and it'll submit for you on an Excel sheet.
Someone has asked, can I become a consultant after JSC FE FRCS? So I think if you search my name in the Facebook, I had given a talk on the details of the FRCS exams and the two versions of the FRCS exams. I can share it to Madam, and she can share it to everyone. So basically, JSC FE offers something called as an international FRCS, which is not recognized. I wouldn't say not recognized, but that cannot be used for getting your CCT. If you want to get a CCT and become a consultant by becoming a member in the specialty register, you need to clear the JCIE FRCS exams. But say if you don't have an MRCS, but you have cleared an international FRCS, you can still get a GMC registration and you can work as a middle grade doctor. But if you want to become a consultant, you have to take the JCIE FRCS exams.
Manikandan sir, if you don't mind, can your slides be shared? You can send it to us, and
Definitely. No worries.
Good evening, sir. This
Yes.
is Dr. Vivek here. Sir, can you just explain more about orthopedics, post MS orthopedics, what are the opportunities are, if you want to do something particular field fellowship, how to go about?
Yeah. So for, again, orthopedics, as I mentioned, the best way for you to come into the UK is to clear your MRCS exams. Unfortunately, MRCS is a common exam for general surgeons, orthopedicians, and ENT doctors. So you need to write your MRCS exams and get your GMC registration. And then, as I mentioned, you go to both of these websites, whichever I mentioned. It's a very simple website to go through. You register yourself, you put your specialty and what kind of job you want to look for. Again, I would suggest you can put as a junior clinical fellow or senior clinical fellow post or whatever, and that will notify you. So the other option for you would be, if you think that clearing MRCS exam is difficult for you, then you can search for MTI route. So you go through, you can open the Royal College of Surgeons MTI. In that, you go in, you can see all the options available in the field of orthopedics. You can apply, you can come in for 2 years and you can work here.
Thank you, sir. Thank you.
Hello, sir. Good evening,
Yes.
sir. Post
Yes, we can
5
hear.
years, sir. Sir,
Sorry?
I'm post 5 years MS, sir. I'm working as a
Yes.
consultant here, and
Okay.
my question is regarding I actually had applied for MRCS about just after I had finished my MS, and I was due to the orthopedic component in it. Many of the questions were orthopedics. As you know that our MS general surgery training, it is very poor regarding orthopedics. So I couldn't clear at that time, then I didn't apply for that. So right now I'm in a state where I have got enough and more experience as far as a surgeon is concerned, because I'm leading here as a consultant in a hospital, a reputable hospital in Kerala. So I have enough, and I have a good CV also, but I'm afraid that, you know, like I may not have I have a good number of record of cases, but I have the logbook with me, the name and all those things. But I want to know, with my experience that I have, and with the current logbook, the number of cases, a lot of laparoscopic cases and all those general surgery cases which I have, bariatric surgery. But with that experience, what pathway is the best pathway for me? I don't want to, I think maybe MRCS or FRCS or MTI.
Yeah. So for you, yeah, again, as I mentioned you, if you just want to come here and say specialize in a particular area, say if you do a lot of colorectal work, you want to come and do a robotic colorectal or a laparoscopic colorectal, or you want to specialize in bariatric, in that case, and you just want to spend within 2 years, then the easiest option is MTI, because you're working. So as I told, the prerequisite is you should be working in an overseas hospital, which you're doing. Okay, you apply that you want to come into the UK. You can put your specialty and they will offer you 2-year temporary registration. You come in, work for 2 years and go back. That is one option. The second option would be to clear either of the Royal College exams. As you told, MRCS for your level to clear means, I wouldn't say it is very difficult, because again, the orthopedic part in the Royal MRCS exams is very limited. But still, if you think that is you will be feeling it difficult to do it, I would suggest you can take FRCS exams actually, because the criteria for applying FRCS exam, even the international FRCS exam, is if you are having minimum of 6 years of training in the field of surgery, which starts after your internship. Say from your first year of MS, if you have 6 years of surgical training, that's more than enough for you to apply for the eligibility. And because you have good logbook, 100% you will be eligible to give your international FRCS exams. So once you clear your international FRCS exams, one, it gives you the tag FRCS, which adds a lot to your CV, and you can use the international FRCS to apply and get your permanent GMC registration, and then you can come into the UK. The problem comes when you come into the UK, say you practice here for 3-4 years and you want to settle down here with your background experience as a consultant. At that point, again, as I mentioned to you, this international FRCS is not valid, and you might need to give your FRCS exams again, which is a JCIE exam, which is the exam which is given only by the UK trainees or the doctors who work in the UK.
Thank you so much for opening up this platform for us. I would love to. We all, I think many of the aspirants never had a platform to work before. Definitely, I'll be keeping in touch with you for.
Keep in touch with me, and you can see I've given my LinkedIn profile and the Facebook profile. We have a lot of materials there. You can join me. I can guide you later. Actually, no problem.
Thank you so much, sir. We'll be in touch.
No problem. Sure. Thanks.
Anyone else?
Sir, can I ask a question?
Sure. Please go ahead.
Yes. Okay. So I would like to give a background. So I am a consultant psychiatrist, and my husband is in his 3rd year MCH neurosurgery. And I would like to do a fellowship in child and adolescent psychiatry, and he plans to do a fellowship in functional neurosurgery. But we are not sure about settling down in UK. So what would you suggest? Like, should we just do a 2-year, as you suggest, specialist fellowship?
Do you have your MRCP psych? And
no.
Does he?
I just have my MD from India.
Okay. So, like as Mani explained, I mean, if you're unsure if you're going to want to stay here, it would, you can come via the MTI, apply for a fellowship, specifically looking at through the NHS jobs, or if you get into touch with any of these departments. So one thing is, if you are focused and you know what exactly you want, for example, you said you want child mental health, identify trust that will cater to your educational goals, and you can get in touch with the program director, see when they open fellowships, okay? And then look out for their NHS jobs. They'll tell you when they advertise. And then you can try and get through an MTI and see if they take MTI candidates, first of all, and then apply via the MTI pathway. If you don't have a certificate, because what you need is essentially to work in the UK, what you need is a GMC registration. What you have to look for is a pathway to that. So without the Royal College, the pathway would be to go through the MTI program. Okay, and that would be for yourself and your husband. Now, as Mani explained just to the previous question, the person who asked the question as well. After that, if you both are deciding to stay, that's when things get tricky. After 2 years, because so everything in the UK is depends on the visa. So when you come on an MTI, you're on a different visa. When you come as a specialty doctor or a fellow, you're on a different visa. The MTI visa allows you to stay for only 2 years and you have to go back. The whole program was designed for people of low middle income countries to come train and take their expertise from UK back to their country. That is the whole reason why the MTI program was initiated. However, because of COVID, they made some exceptions and allowed people to actually stay back, which is sort of like a loophole in the system. Okay, but that's not going to persist. Okay. However, people have cleared their Royal College exams while they've been here for 2 years. And then what they've done is left the country and come back on a tier 2 visa. Okay, so I am currently on a tier 2 visa, and that's what I came as a fellow. Or when you come as a specialty doctor, a clinical fellow, you come on as on a tier 2 visa, and that is tied to your trust. If you want to change jobs, you have to change visas as well. So that's something important to understand. Okay. So both of you, you can, if you're coming as MTI, you both need to come in individual MTI visas.
Right.
Because you cannot come as dependent and then apply as an MTI. I know a few of my friends who've come like that and they've been stuck because their spouse has come under their dependent visa and they can't look for a job because they don't have GMC registration. All right. The whole purpose they migrated was for both of them to get some UK experience. And there are a few of them like that. All right. What you don't want is to come here and then be stuck.
Right.
Especially for couples, always look into those aspects. If you're coming via the MTI pathway, please clarify you both will need to come in your own individual MTI posts.
Right.
Whereas if you're coming in tier 2, for example, Hanfa and I, my wife, so she's on my dependent visa. She has come as a specialty doctor, okay, and she's come through a recruitment pathway. So when Mani explained the pathways, one of the things, if you have a Royal College qualification, you can get a GMC registration that way, and you can get a specialty doctor. There are recruitment agencies which will actually hunt and find you jobs as well. So that is, when you have a Royal College, it becomes way, way more easier. Options are, really diverse.
Okay. Yes, got it. That explains. Thank you so much, sir.
No problem.
Yeah, there is an interesting question in the chat by Nishada. So my spouse already works in the UK as a surgery registrar. I am a final year MD radiology. What would be the best plan to join the MTI program regarding the visa application? Since you mentioned GMC would not accept application from candidates with, yes. So if you already have a dependent visa based on your husband, maybe, I don't know. So if you already have a dependent visa, you cannot apply through the MTI program, even if you are working in India. That's the answer for that. So that's the problem there. If you have a dependent visa, you cannot. You should not hold any visa when you apply for this.
Oh, they already have a visa, is it? Is that what they're saying?
Yeah.
Oh,
yeah.
That's a problem. That is a problem.
Yeah.
Good evening.
So one thing people need to understand in the UK is the Home Office is one of the most difficult people here. So the people who issue visas here, they're extremely difficult and they scrutinize things in a lot of detail. So you have to go through the nitty-gritty details of immigration and visas, and that's something that people tend to overlook, and it's very important.
Hello, sir. I'm Nisha. Good evening, sir.
Yes. Good evening.
So I don't have a dependent visa yet. I have only
Okay.
been visiting my husband on tourist visas. I'm still completing my MD radio diagnosis. He already works there as a surgical registrar.
Then,
Yeah.
Then it's fine. Then it's fine.
yeah, then it's fine.
Don't even apply for a dependent visa.
Yes.
Okay.
If you even if your application is there, you won't get it. Even if your visa is rejected, you won't get the MTI. So don't apply for a dependent visa. Just apply through MTI. Wait for the MTI to sort out, and then you can go there.
All right. Okay.
I mean, I would, I would really advise Unisha, apply from India itself. Even if, if you're thinking of applying from UK, also it's safest always to apply from India.
Yeah.
Okay, sir. Thank you so much.
And just to FYI, because you're a radiologist, for those radiologists out there, there's a lot of shortage here. There are a few of people who I know who've completed after their FRCR, and they've got straight locum consultant jobs. And their trusts actually, they help them to get substantive posts.
All right.
Okay. Yeah. So basically what you want to get is what is called a substantive post, which is a permanent post. So for example, myself, because at the moment, I'm showing the evidence that I have done. So the CSER pathway, if you've not gone through deanery, what you're trying to show is you're showing evidence that you have fulfilled the training requirements of a UK training based on that specialty's curriculum. Okay. And that's there on the GMC website. And if you want to get a substantive job through the CSER pathway, you have to show that you've done everything that a UK trainee does, which is required from that curriculum, and tag it to that curriculum. Okay. Right. So there are people who do it prospectively after coming here on a locum consultant job or on a middle grade job. They collect the evidence and then do the CSER. For those who don't want to get into training for whatever reason, either they're experienced and they, but if you are, for those who are young and have time, post MBBS, it's best to go through the training itself. But for yourself and all, I would highly recommend completing the FRCR itself or MTI.
Okay, sir. Thank you.
There's another interesting question in the chat box. Is it difficult to go for MRCP or a surgical career rather than medical training in UK?
Well, I think unlike the US, where getting a surgical training is nearly impossible. That's what I heard from my colleagues. UK is not so. I think in the UK, people tend to prefer surgery less when compared to the physician job. So there are plenty of surgical opportunities available. So it is, I would say getting a surgical post is much easier than the physician post in the UK. It's the other way.
And for those who don't know, part of it is also because in the UK, when you become a surgeon, you become Mr., not a doctor.
Yeah.
After studying for X number of years, you drop your doctor and you become Mr.
Yeah.
So if I may clarify my question there, this is Akash. I was there for general surgery. Dr. Mani, hi, nice to see you.
Hey, Akash.
Hello, sir. Sorry about the poor lighting here.
That's okay.
Yeah, so my question specifically was, I have a few friends over there and they were saying that it is quite difficult. You might find jobs and you might be stuck at the registrar level, but to get into a training program as such in surgery is difficult. So that is why I put across that question.
No, the problem is, see, what happens is you finish your general surgery, you come here as a junior fellow or senior fellow, whatever. And as I told, if you want to join ST3 straight, okay, the difficulty comes when you submit your application form. As I mentioned before, for a UK trainee, when they finish FY1, FY2, CT1 and CT2, they would have completed a lot of paperwork, which includes publication, case-based discussion, audits, their various things which we don't do at all. So when we want to come in and start straight as an ST3 through a training pathway, filling this competencies is the most difficult thing, but the availability is there. In fact, there are a lot of spaces which are vacant actually. There are people, there are vacant spots, but when we want to submit all these competencies in a paper format, that is the difficulty which comes. That's why I'm telling you, we need to try to build our CV even when you are in India by doing all these things, and try to keep a record of whatever you do. There are many questions regarding the MRCS exams, preparing the logbook and stuff. So I will share my contact with PG Nair madam, so you can get my contact, or you can search my name in the Facebook, which has all the links for whatever we are doing as a group. It's not only me who is doing, but again, it's predominantly the Amrita alumni who are doing everything actually. So you can use our thing there. You will see everything there.
Hello.
Yes.
Hello, Dr. Manikandan. I'm Ranjit.
Hey.
Hi. I had a query. If suppose you have completed your FRCS from JSCP, will you be eligible for a Caesar pathway directly?
No.
Okay.
No. You need to clear JCIE FRCS for Caesar pathway. But you can get your GMC registration and you can work as a middle grade doctor, but not as a CCT or the Caesar pathway. That is at this point, but even the GMC means the Royal College website has given a clause that in the future it might be considered for that, but as of now it is not considered as a thing. There are plenty of questions in the chat actually.
Yeah. Should we just go through that? I mean, we're actually. So
please, you can answer some of those, Cheta. It's okay.
Yeah. So one of them is how different is it to do core medical training in India and coming for Part 2 MRCP different from starting with PLAB and starting with foundation training? Okay, I presume what you're asking is to do this. I think there is a pathway where Aster does this sort of like core medical training, and then you join after MRCPCH. So it's essentially one thing in the UK that I think you pay a lot of money for doing this core medical training in India, correct? Whereas essentially here you just apply and you come straight. So you clear your PLAB and you're in the system. I would always recommend, if you have the opportunity to go through the system in entirety, that's the easiest, because you learn how to work. There is a lot of things here in terms of research, audits, different courses. The system is quite different, and you will only learn that when you're running through. And as you start as a junior trainee itself, you pick up all of those skills as you run through training from a foundation level all the way to your ST 6 or 7. So I would always recommend that over coming here halfway if you have that option. Yeah. The other questions, I'm an MBBS graduate who would like to specialize in emergency medicine. Could you give me a rough idea on how to proceed after clearing the PLAB? So essentially it's the same. So after your PLAB, you apply for a foundation year job, you come here and then you go through your ST training you have to apply for your ST post in emergency medicine for a training post. And that's how you go and you build up from there. The other route is actually to do your MRChem exams. So if you need this specifically, I can say there are about 3 of my batchmates, 4 of my emergency medicine, my batchmates in emergency medicine here in the UK at the moment. 3 of them are in training, actually. So one of them started as an ST1 level, and the other 2 have now just recently joined in an ST3 level. Okay. So previously, emergency medicine, if you joined partway ST3 level, you would get what is called a Caesar CP. Now they've changed it to a CCT. So the letters matter because the value matters in different places if you go abroad. Okay, that's the only thing. But now the value is all the same. So if you've completed your MRChem, you start midway, just like other specialties, and you get a CCT. So you have to look at GMC guidance, and you also have to look at your college guidance as well. So for the person who's starting straight after PLAB, you run through you finish PLAB, you apply for a foundation job, and then you apply for emergency medicine training through the website there. Okay. As a
There There is a question asked by, I think, one of the surgical postgraduate. I think, can you please share the basic structured logbook? So the Royal College provides a free logbook for every surgeon. If you search as e-logbook in your Google, that leads to the e-logbook Royal College website, and it is a free logbook which any surgeon can use and log in. So you need not pay for anything. So that is the structure which is accepted anywhere in the globe, I would say. What's next?
There's as a consultant without much research or publication, how MTI will help for training? Is the question, are they asking about getting an MTI job per se, or fulfilling your training needs? I'm not quite
no,
clear.
I think he is asking if how, I mean, as a consultant, how MTI will help in training in their specialty, maybe. Someone is okay. Okay. Hello. Oh yeah. So I think if the question is how MTI will help, so if at all, if you think that any particular area you need to specialize, then probably you can still take MTI, come here and specialize in that particular area for 2 years, as we mentioned before. But getting into a training program is, again, you need to have either of the Royal College exams or the PLAB exam, and you need to start from ST3 or do your FRCS exams and get the CSER route to get your CCT. So that's the pathway, actually. What is your experience on the racism? Okay, so
that's a very important question.
Yeah, exactly. So at least in the places where I worked in Cambridge and London, I don't think there is any kind of racism. That's what I feel, especially London, where I think it's so difficult to see English people at all. It's all only Asians are there in London. So I don't think there is any racism, which I have experienced till now, but I don't know about Vajesh.
Yeah, so I work in Birmingham, and Birmingham's got the highest population of Asians. It's one of the cities which is, so it's the second populous city after London, in fact, and we've got the highest percentage of immigrants, especially from Southeast Asia. So one thing to understand is that now at the moment, NHS gives a lot of value to inclusivity, diversity, and equality. Okay, so every staff is required to take training in EDI. Okay. So at the surface, you should not be seeing racism within your trust. But having said that, everybody has, their own, subtle things are there. My experience so far in my trust, I haven't had any issue, to be honest. And if you work within the NHS now, you will find that the number of immigrant doctors are that high, especially now post-Brexit. The number of Indian doctors are a lot more. So racism, yes, it does exist. It is an issue. There are, we do hear it from time to time. I know colleagues who faced it previously. If you're active on Twitter, you will see it coming time to time on everybody's feeds. But it is a thing which is not just NHS bound. Within the UK, you will find, especially with a lot of refugees coming in, you'll find cities where you have a lot of immigrant population, and then there are pockets where, especially towards the countryside, which is predominantly white British. Okay, and it varies on where you work. It's best to actually chat with people where if you've got a job or you're applying for a job, to ask them what their experience is. It's different in different places. But as a system, as the organization, they are. It is seen. What I would say is, if you face racism, if you come to a job, it's important to call it out. That is my main message. Okay, and that is the one thing that I have seen our trainees and staff, they don't call it out because we don't recognize what racism looks like, and when it is called out, it is dealt seriously. That's my main message.
Yeah. Okay, so someone has asked to elaborate about the CSER pathway for a super specialty trained doctor in India. Okay, so as I told, CSER pathway is a very difficult pathway. First thing is you need time for you to finish your fellowship exam. If you're a surgeon, you need to do your FRCS exams. Again, JCIE exam, for which you need to be in the UK minimum of 6 months to 1 year before you apply for the exam. So for clearing the exam, it will take 1 to 1.5 years. And then the minimum evidence which we need to submit for CSER is somewhere around like 1,000 to 1,200 pages. So from what I heard from colleagues who had done CSER pathway for surgery is it minimum takes 2 to 3 years. That's what I was told, but I'm not sure because I'm just beginning the thing here now. So this is about the CSER pathway. Someone has written, I'm a practicing gastroenterologist. Sorry. So I am a practicing gastroenterologist. After clearing MRCP, at which level will I join in UK? How can I get gastroenterology training in UK? So again, I think because you have cleared MRCP, you can easily get your GMC registration by clearing your English exams. And as we discussed before, you can, if at all, if you want to join the training number, you can start from probably ST3.
Yeah.
ST3.
So it all depends once you come here after your. So when you need to look at opportunities and the number of posts available and when they open up. So so you have to go to the websites and look at the dates when they open. If you've cleared your MRCP, and then apply for that specific year and post when it opens up.
Someone has asked about, does it matter giving a first MRCS Edinburgh versus others? So all the MRCS and the FRCS exams are intercollegiate exams. So it doesn't matter. You can take whichever college you want because the curriculum is the same, exam pattern is the same, the evaluation is the same, and the value is the same. So even if you take a part 1 MRCS in, say, Royal College of Surgeons of England, you can take part B in Edinburgh or wherever. So even for the FRCS exam, it holds the same. So it doesn't matter whichever college you choose. So that's it. I think that's it in the chat.
There was a question actually sent to me directly. So there's somebody who's post 4 years of pediatrics experience and they're planning for a DM pediatric super specialty program, either neuro or cardio in India. They haven't joined one, but they're preparing now for it. What are the options in UK after my 3 years of DM super specialty course? I plan for a permanent settlement in the UK, want to become a consultant in that super subspecialty. Would it be a bad decision to go for a super specialty program in India? Now, if you're planning to settle in the UK, see, if you've done so much of training and to come back, for example, if you've done pediatric cardiology, I'll tell you, and to come back here, and if you want to work here, again, the pathway is you do your MRCPCH, you have to go through the training from an ST4 level is the highest you can start, and then you have to apply. And pediatric cardiology is quite competitive, but if you've got the experience, you can get into training, but you will have to go from an ST4 all the way to ST7. So ST4 is pediatrics. You'll have to do community pediatrics, you'll have to do neonatology, and that's ST4, ST5, 2 years, and then you have to apply for pediatric cardiology subspecialty training. So that's a separate application. That's another 2.5, 3 years of training. The other option is the CSER pathway, which we, and that's very difficult. If you have all your evidence.
Sorry.
I'm checking the room because I need it for.
Yeah, so if you have your evidence already collated while you're training for your DM, and if you're going through the GMC curriculum for pediatric cardiology or neurology, whatever you're doing, and you're managing to fulfill it while you're doing your DM, collecting your paperwork for GMC, for the CSER, then yes, that you can save time and try and apply CSER. So one of my colleagues in Qatar, who was doing pediatrics as my senior, she knew she wanted to go and settle in the UK and collected her evidence before she arrived in the UK itself. She just had to do small bits and bobs after coming to the UK. And within a year, she got her CSER, less than a year. Okay, so you can plan things and work proactively. Okay. But if you're sure you want to come to the UK, then that's something you have to think about which pathway you need to take. Okay. Which is why you need to answer those first questions. What are your goals? And the other thing I just wanted to talk about, which is important in terms of work-life balance, the work hours in the UK are about 40 hours if you're a specialty doctor or a consultant, and trainees go up to 48 hours actually, okay? Which is still pretty good compared to North America, where I've trained in Canada, my work hours were 80 hours a week, okay? So that's a lot better. The pay in UK for consultants compared to North America is much less. Okay, so trainees get paid slightly higher compared to North American trainees, but the step up from a trainee to a consultant in UK is, you'll probably see maybe 100 or 200 pound rise in your paycheck when you become from a senior trainee to a consultant. But a step up is almost 2 to 3 times in North America from trainee to consultant. In Australia, the perfect place, work-life balance plus the pay is the best. So just FYI to put it out there. For those who are actually thinking about coming here to UK, working, and then thinking of going to the Middle East to try and make some money for X number of years, whatever. If you're planning to go to the Middle East to go as a consultant, please remember, Middle East looks at CCT for a consultant job. They do not accept clinical fellowships. They do not, some places you have to look at the licensing requirements, for example, for Dubai, Abu Dhabi, or whatever, and you have to look, some will only accept a Caesar. Not all accept a Caesar. So if you're specifically, are targeting Middle East, please, then it should be deanery training. I hope that some people, it's clear for people who are thinking of that.
So my question is for Mani, sir.
Yes.
So I'm Dr. Priyanka. I'm in final year of neurosurgery residency. So just wanted to know, sir, hi, sir, that as you told that once we start, after getting my MRCS, we'll start from the ST3 year. So that will be equivalent to a residency program there?
No, ST3, I would say it will be equivalent to, say, a final year MS general surgery in India, probably.
Okay, so we have to start back from there, like even after finishing.
Yes, exactly. So that's why, see, I finished my MCH from India and then came as a fellow, and I don't want to go back and start my training as ST3. So the only option left for me is doing the CESA pathway, so which I'm trying to do. So, but if you want to go through the training pathway, then you need to start from ST3 at least.
Okay, and so fellowship is like through the MTI pathway you have done, sir?
No. It's not through the MTI pathway, because I had the MRCS before. I had a permanent GMC registration and I applied for the job and I got the job.
Okay, so it's not a training, it's a job as a senior
yes,
fellow.
so a senior, when we say a senior clinical fellow or a junior clinical fellow, whatever, it is basically the title of a job, that's all. So it is not like, it's not like a structured fellowship program or something. So you will be given a fixed term contract. Usually it is 1 year. You come here, work for 1 year. At the end of 1 year, if you want to extend and work the same, they will give another certificate of sponsorship. You can extend your visa and you can continue to work as many years as you want, or you can stop it whenever you want and you can go back. So as I told, and at the end of your work here, you will get a certificate or an experience certificate that you worked in this particular hospital, in this department, so on. So you can still get papers signed by your consultants and things like you. If you want to use it back home, you can get that you were particularly trained in this particular area, etc.
And sir, like once we clear our MRCS exam, for how long does it get valid? Like the result gets valid, because USMLE, like it's a permanent thing.
Yeah, so USMLE exam, you cannot compare USMLE exam and the MRCS. Maybe USMLE you can compare with the PLAB exams. So once you clear MRCS exams, you have to pay the Royal College the MRCS retention fee every year. You need to pay money. Okay, so for MRCS, I think you need to pay £50 per year. For FRCS, you need to pay £600 a year for you to use your degree. Okay, so as long as you pay the Royal College, MRCS is valid for lifetime.
Okay, so the GMC registration, once you get, it will be like valid.
Again, yeah, yes. So
if you don't get a job.
Yes, even so, if you get a GMC registration through MRCS pathway, it is a permanent registration. Again, to continue your registration every year, you need to pay a fee of around £500. If you don't pay, if you don't say, for example, you got your GMC registration, but you're not getting a job, or you don't want to come into the UK, there are two options. One is you continue to pay and continue your GMC registration. You'll be paying like 50,000 rupees per year, or you can keep your registration as dormant. You can tell that you want to stop it temporarily and it will be kept as a hold. You need not pay, but when you come back, you can take it. But when you don't intimate GMC and if you don't pay for more than 2 years, then your GMC gets lapsed and you need to do the entire path again. And the most difficult part is giving your English exams. You need to give your English exam again. You need to submit your MRCS and get the thing again. So these are the things if you don't want to, if you have the GMC and if you don't get the job.
Okay, thank you, sir.
Okay, so shall we wrap it up? Because it's already going to be, I guess, 30. Yeah. So I think Manikandan sir will be sharing the PPT with us, and any queries you have, you can still, alumni office you can contact, and we'll further help you to contact Fajish Chetan and Mani sir. Shall we end this session? So, Sudhir sir, anything you want to add, sir?
If there is no other questions or any other comments, I think we will wind this session. Thank you very much, Mani and Fajish.
Thank you, sir. Thank you, sir.
I would really like to thank all of you. First of all, I would like to thank the person who had the vision to make this college. Otherwise, we all wouldn't be here at all. That is our beloved Amma. I would like to thank Prem sir, who took his time to be with us in spite of his busy schedule. We all know he's out of state. Actually, he's in Delhi. Marwa sir, in spite of being a Sunday, he came, our principal medical school. Sudhir sir, our beloved teacher, Sudhir sir, and Pradeep Jacob sir, thanks for being here. And a big thanks and happy birthday to PG madam, our chief coordinator. Actually, she has been working for this for the past 1 month or so for this particular 2 hours for this day. So a big thanks to her. Then our president, alumni president, that is Dr. Balaji, I would like to thank her and Priya for company. Actually, she had another program at 8 o'clock today, so she has already logged out. In spite of that, she helped us out. And all other alumni and students who have been here today with us, I would like to a big thanks to all of you guys for making this a huge success. I think we'll wrap it up with national anthem. The national anthem, actually, which we are playing is played by Dr. Siddharth, who is again my senior, 2002 batch. He's an excellent musician. He has actually played this in his violin. He's a violinist.